in terms of credible sources. And Divers Alert Network has long been that source around health and safety in the dive industry. And so with that, I'm going to transition to Dr. Matias to talk a little bit about what you've been seeing and what DAN has been doing around the COVID-19 pandemic, and what recommendations are starting to emerge around precautions that divers should be taking to dive safely.
Thank you. Yeah, so we've also seen the crisis in the diving industry. We thought of the hotline being somehow the thermometer of what is going on, right? If we get the same number of calls all throughout the pandemic, then we can say, well, it seems like, at least based on what we see on the hotline, there is no effect. Well, that never happened. we did see the effect. Clearly, without travel, there is no diving for the most part. And so we did see the effect in the diving industry in that sense, a significant drop in the number of calls, particularly on the emergency line, because of course people were not diving. That is absolutely secondary. When in a pandemic, we always use not just the number of cases and the positive results on tests, but also the number of beds in ICUs, right? How many beds on an ICU are being used by COVID? So we thought to ourselves, well, this is our beds on an ICU. What is going on with the industry? And perhaps that is a good reflection of what was going on. A significant dent, particularly in the months of March and April, and then slowly recovering. And right now, we can say that the activity seems to be normal for us, because it's not, but it is catching up, it is warming up, and that's a positive sign for sure. What we saw during this crisis and during the big dent in this crisis is, of course, a huge number of calls, not on the emergency line, but on our medical information line about COVID. So what is this? How is this going to affect my diving? What is going to happen with me? I mean, I read somewhere there that if you have had COVID, that's it. Game over for diving, right? You're not diving anymore because your lungs are in pieces. And so we put up like you guys said, we tried to do our best and giving back to the industry our 2 cents, and literally our 2 cents, because there are no COVID experts. This is a new disease. This is not something that we can say, well, we know what happens now and we know what will happen in 6 months, because nobody has been in the future, right? So when these reports and concerns about people thinking that, well, if you've been affected by COVID, that's it, it's game over, you don't dive anymore because your lungs are in pieces, or they will be in pieces. We truly don't know. It's a new disease, and we do know what we know is based on what we know from other viruses and from other lung or pulmonary infections. And regardless of the virus itself, when someone has had a significant lung infection, a significant pneumonia, like what happens in a fraction of the COVID patients, it is possible that maybe the lungs are in such a bad shape that diving may not be advisable anymore. But it's not binary. It's not like if you have COVID, that's it. Each case, at least what we think now, what we think is going to happen is each case will likely be its own universe. And a positive diagnosis of COVID-19 with a history of pneumonia, that case, that candidate, that diver, he or she needs to be reassessed for fitness to dive the same way as he would have had to be reassessed with any other comparable lung injury. Now, this is what we know now. Things may change, right? That's the beauty about science. With new information, things change, and we may say, you know what we thought 2 months ago, it's no longer true, because we now have new data. And what we do with this new data is we reassess everything and we change. The same thing happened with, for instance, with the face masks. Use them, don't use them, they're useful, they're not. Well, with the abundance of new data and new understandings of what was going on, as information keeps coming in, everything reassesses and the recommendations changed. And that is not saying, well, you guys don't know what you're talking about because you keep changing your mind. No, it's quite the opposite.
Yeah.
It's the way science works. New data, new information, new recommendations. So at this point, what we think, and I want to reemphasize, right, and highlight, at this point, what we think is each case will likely be its own universe. We cannot say that cases of COVID recovered lungs have this or that effect or outcome, because at this point in time, even if someone has had COVID, say back in January, now in July, August, those lungs, they may be reaching the point in which the injury is becoming more stable, not resolved, not cured, just stable. So whatever happened, this is likely how the lungs will end up being. So now, okay, this is the point in time in which you say, can you die with those lungs? And it's not just the lungs, right? Because it took a few months ago, we didn't know that COVID had effects in other systems. Now we know, and a good fraction of the patients, they also have cardiovascular effects that we didn't know anything initially when we thought this was a flu, a respiratory, and only a respiratory disease. So we wanted to bring some peace of mind to the community, or if not peace of mind, to at least try to minimize the paranoia by saying, calm down. First off, not everybody that has been infected with COVID will die. Not everybody that hasn't been affected with COVID would have any symptoms at all. Thankfully, the vast majority they don't have anything. And for those fractions that actually have had some significant lung injury or pneumonia, let's wait and see. Don't rush. We're not going to recommend you jump in the water right away just to see what happens. But let's wait, give yourself enough time to recover, to make sure that that injury is stable, and then consult someone, ideally a pulmonologist. If he or she has dive medicine experience, great. If they don't, that's what we can help with, right? So they can be the pulmonology doctor, and we can give them our 2 cents in terms of what we know about diving and what the requirements for diving for a diver are. And then with that, we can probably make a decent team and provide the diver with some good information and good recommendations as to what is best.
That's fantastic, and I think the central theme around information being king, and also to be wary of misinformation in an age that we live in where there is a lot of misinformation. Right. Before I transition to the last segment, I know that several questions have been coming in. I just wanted to let the audience know that we will be addressing them after Tanya's segment. Additionally, if anyone has questions that haven't been addressed yet, please start to populate them in the Q&A tab, because we'll be moving to that segment just after Tanya's segment. But